This one is actually part of the quality management group, and it was an abstract that was put in by my quality manager. So this is a young girl that we brought in for transplant. It makes us sound like we're really bad at this, but we brought a patient in for transplant and seen her in clinic and consented her to transplant. And we'd gone through all the fertility issues and recognised that she was going to have cyclophosphamide and total body irradiation. She would be infertile after this, or likely to be infertile, and she'd already had fertility discussions. So we brought her in for transplant. She'd had 3 days of chemotherapy. And then when she went down to radiotherapy, she had a bit of a panic attack in the radiotherapy department. So we couldn't quite understand what was going on. She came back to the ward and then disclosed that she was in fact 16 weeks pregnant. So that's really, really difficult. Obviously, giving radiotherapy or a transplant to this sort of young girl was difficult. Fortunately, she had a chronic disease. She had CML. And we were able to sort of just hopefully recover her from the chemo that she'd had. And she's actually gone on to have a live birth, and the baby's now 1, but it was a bit stressful at the time. So it was again just to highlight that these important factors can occur. And one of the things that we highlighted is she always came to the consultations with her mum, and she was only 17 and mum didn't know she was pregnant. So she just was keeping it a secret from everyone until it got to the point that she felt she couldn't do it anymore. So it's really just learning curves for us, really. So what we've put in place from there, we've obviously put in place, it's specific now on the transplant consent form, that there's a clause that says, I confirm that I'm not pregnant. And if they say that they're not, then we have to believe that. But also we can do pregnancy tests as well. But we also found that we should really be seeing these patients outside or in a clinic without immediate family members, so that they are able to disclose any information that might be relevant.